Sweetser has been awarded a $2 million contract to build a new facility on its Saco campus.
The building will be the first of its kind in Maine, designed for children needing intensive care that may pose a risk to themselves and others.
The Saco-based behavioral health nonprofit says a PRTF could help bring Maine kids receiving services as far away as Arizona back home.
Van Bramer says the facility would feature high security aspects and cater to anyone 22 and under. Her hope is that most would move out of the facility within a year.
Work is now underway on Maine's first psychiatric residential treatment facility for children and youth on Sweetser's 200-acre campus in Saco. The secure facility will help address a crucial gap in mental health services and allow kids currently in out-of-state treatment facilities to return home.
So not many not-for-profits can say they've been around for 200 years. And Sweetser's success is partly attributed to the fact that we are able to pivot. We're able to be innovative to meet the current needs of our communities and of our children and families. We know we are in the midst of a youth mental health crisis. There is universal agreement on that. So we are trying to meet that moment with the creation of this program. It will be the first in Maine. Every child deserves the right to succeed. Every child deserves the opportunity to become a successful and productive member of society. A PRTF is a level of care in between an inpatient psychiatric hospital and community behavioral health services. So right now, there's a gap in that Maine doesn't have a single PRTF service, despite the fact that over 35 other states all have PRTFs. Some have a dozen or more. So what does this mean for Maine kids? Maine children who require this level of care end up languishing in hospital emergency rooms, sometimes not just for weeks, but for months. Or they end up stuck in inpatient hospitals, or they're sent to other states who have this level of care. In fact, about 70 Maine children are in other states receiving this level of care, and about 100 are on a waiting list to be sent out of state. And this is costing the state of Maine about $30 million a year. Placing children hundreds, if not thousands of miles away from everything they know and love disrupts their connections with their family, interferes with the support from their family, separates them from their friends and communities and everything familiar. Plus, it's very difficult to actually monitor and provide oversight of what's happening in these programs in other states. And of course, it costs more.
We do know that there is a shortage of what we call high-intensity services. So Sweetser's really stepped up to the plate here to offer those. And you know, there are 4 levels of high-intensity services, and those are the assertive community treatment, and that's the ACT services, therapeutic intensive homes, which is something that is in the development stage, child residential services, and psychiatric residential treatment facilities. Just to imagine walking in to what will be a beautiful facility that really is going to be safe, but also the rooms are going to be spacious and therapeutic and set up for safety. So ensuring that the youth feel safe, that they have a milieu that is set up and spacious for them, that the walls are decorated in a way that makes youth feel safe, that it's part of trauma-informed care, which is going to be very important in this milieu. There will be 4 separate and distinct treatment rooms for the youth to take advantage of, including places for youth to go to enjoy quiet and peaceful space with their staff if they need that. We are going to ensure that youth always have an opportunity for things like mindfulness and yoga, arts and crafts, if that's part of their treatment and that's something that they find to be therapeutic. There's lots of space for the youth to interact with one another, which is so important. We're really excited about an outdoor space that they can take advantage of seeing the serene outdoors here at Sweetser. One of the things that's very important regarding trauma-informed care is having the feeling of being safe, and that includes things like just how we see the world around us. The psychiatric residential treatment facility here at Sweetser is going to have that feeling. Youth will be able to participate in group therapy in addition to the individual therapy and the medication management and family therapy. By having this program here in Saco, we are able to work with youth and families to be able to do an average length of stay here. The hope is 9 months to a year. And then these families can be able to access a multitude of appropriate levels of care after treatment here. One of the things that's going to be so important about this is that each one of the hallways that these youth live in will actually be painted and decorated in a way that supports the feeling of nature. One will be, I believe, a forest, one's an ocean, and one's mountains. And so we're going with that nature theme because here in Saco, that's what we're in, is nature. Here in Saco, we have a family apartment that is available for all families that come. And we schedule families that are from, far away to come and take advantage of that. It's free of cost. And so people are able to come and visit their youth while they're here. Families and youth will work together when a youth is admitted to this facility to develop an individual treatment plan. And that treatment plan will really have the goals of both the youth and the family that they develop together, really focused around safety and stabilization. Those goals will help them to develop what it will look like for the youth to be ready to discharge.
Intensive, appropriate intervention actually prevents children from interfacing with the juvenile justice system. It prevents placement in foster care. It increases positive educational outcomes. It really does have a positive impact, not just on that individual child, but on the society as a whole in terms of preventing extreme costs down the road on our social service systems. Supporting PRTFs and supporting the development of one in Maine is not only a compassionate thing to do, it's really an act of wisdom in strengthening our society down the road. So there is so much about this program that excites me, but primarily it's really about giving hope and support to those children and families who feel like Maine has forgotten them. This program will help these children and families heal and thrive and become productive members of our community. Collectively, we have a responsibility now to meet this moment, to help these children heal and to help our communities thrive. Now is the moment to act. So help Sweetser bring Maine children home, and let's keep our children in Maine.